In 1917, a soldier lay in a French trench for 4 days with his stomach torn open, certain he was going to die there. No one had come. When a doctor finally reached him, the smell hit first, then the sight. His wound was moving. Crawling with maggots. The doctor almost turned away. He didn't. And what he found instead would take him nearly a decade to fully explain. The soldier's wound was cleaner than the ones being stitched up in the hospital tents behind the lines. Somehow, days of neglect in a trench had left him in better shape than men getting proper care. That discovery got buried for almost a century. And right now, in hospitals treating infections nothing modern medicine can touch, it's quietly coming back, because something you've probably never thought twice about is becoming one of the biggest threats to your own future. Here's what you've likely always assumed, without ever really questioning it: before modern medicine, an infected wound was a death sentence. No antibiotics, no sterile bandages, no ERs, so people just died, helplessly, and that was that. You've been sold a half-truth. And the real story is stranger, and more useful to you, than the one you were taught. In the ruins of ancient Sumer, archaeologists found a clay tablet from around 2100 BC, the oldest written medical text that exists anywhere. Someone, 4,000 years ago, sat down and wrote out a treatment for wounds. Honey. Not superstition. Not a desperate last resort. Medicine, written down as fact. Go to Egypt, centuries later, and you find it everywhere. The Edwin Smith Papyrus, around 1600 BC. The Ebers Papyrus, roughly 1550 BC. Both describe the same standard treatment: grease, honey, and plant fiber, pressed directly onto an open wound. Honey appears hundreds of times across Egyptian medical writing. Not a footnote in their medicine. The backbone of it. For 3,000 years, no healer could have told you why it worked. They just watched, generation after generation, the wounds packed in honey got infected less. They healed faster. Mothers taught daughters. Healers taught apprentices. Nobody needed a reason. They had something better, it kept working. You get to know the reason they never had. Honey is naturally acidic, low in moisture, brutal terrain for bacteria trying to grow. But underneath that, something more precise is happening. Certain enzymes in honey slowly generate small amounts of hydrogen peroxide as it sits on skin, releasing a steady trickle of antiseptic on its own, hour after hour. Lab tests today show it killing an enormous range of bacteria, including resistant strains like MRSA, the kind that can shrug off modern hospital drugs entirely. Nobody in Sumer had a microscope. They just knew which wounds survived. And honey kept showing up on the winning side, over and over, until it didn't need explaining. It needed using. That's the first thing they knew, and we forgot. Here's the second, and it's almost hard to believe anyone tried it on purpose. Around 1500 BC, that same Ebers Papyrus records another Egyptian remedy: moldy bread, pressed straight onto an infected wound. Picture that decision for a second. Someone looked at rotting food and chose, deliberately, to put it on an open injury. And it kept happening. Greek physicians did the same. Chinese healers used moldy soybean curd on skin infections as far back as 3000 BC. Aboriginal healers in Australia scraped mold directly off eucalyptus bark. Centuries later, French peasants were still smearing moldy bread and jam on cuts, with no idea they were repeating something Egyptians had already done 3,000 years earlier. None of these people ever met. None of them had a word for bacteria, or fungus, or infection in the way we mean it now. They just had eyes, and patience, and generations willing to pass down what quietly kept working. In 1928, a Scottish bacteriologist named Alexander Fleming came back from vacation to a messy lab and a petri dish he'd forgotten to clean. Mold had grown on it. And around that mold, the bacteria he'd been growing were dead. It became one of the most celebrated accidents in the history of science, the discovery of penicillin, the drug that opened the entire age of antibiotics. Here's what almost nobody says out loud about that moment: Fleming didn't discover that mold kills bacteria. He discovered why. Ancient healers had already found the effect itself independently, on 4 separate continents, over 3,000 years before he ever looked in that dish. 2 things they knew without knowing why. Here's the third, the one that saved the soldier in the trench. Maggot therapy sounds like something out of a nightmare, not medicine. But it may be one of the oldest continuously rediscovered treatments on Earth. Ancient Mayan healers used fly larvae on open wounds. So did Aboriginal healers, in the very same region where they were also scraping mold from trees. Two completely different solutions, found by the same people, for the same enemy. Here's what's actually happening, mechanically. Maggots eat only dead, infected tissue. They leave healthy flesh completely untouched, like a scalpel that somehow knows, on its own, the difference between living and dying cells. While they feed, they release enzymes that break bacteria down at the same time. Precision surgery, performed by insects, for free, with no training required. The doctor from that trench, William Bear, carried what he'd seen back to Johns Hopkins after the war. He tested it properly this time, 21 patients, severe chronic wounds, bone infections underneath. The kind of injuries doctors at the time considered nearly hopeless. 2 months later, every single one of them had healed. Then antibiotics arrived in the mid-20th century, and maggot therapy disappeared almost overnight. Understandably, a pill beats insects on an open wound. For decades, this entire branch of medicine simply vanished. Case closed, everyone assumed. Ancient medicine, quietly replaced by real science. Here's where this stops being a history lesson and starts being about you. Bacteria evolve. And antibiotics are losing that race. In 2021 alone, antimicrobial resistance was directly responsible for over 1 million deaths worldwide, and linked to nearly 5 million more. Projections published in The Lancet estimate that between now and 2050, resistant infections will kill 39 million people. That's roughly 3 deaths every minute, for the next 25 years. Right now, about 1 in 6 lab-confirmed bacterial infections on the planet no longer responds to the drugs built to kill them. This isn't a distant problem for someone else. It's a countdown, already running, on infections that used to be routine: a scraped knee, a dental abscess, a simple cut that got infected. So doctors went looking backward. Maggot debridement therapy is cleared for use in wound clinics today, specifically for the infections antibiotics can no longer reach. In severe cases where amputation was the last remaining option, it saves the limb roughly half the time. Honey-based dressings are back in hospitals too, treating the exact bacteria modern drugs have started losing to. 3 ancient methods. Never actually wrong. Just declared finished a little too early. Here's what almost nobody connects. Ancient healers had no microscopes, no germ theory, not even a word for what they were fighting. What they had was something slower and much harder to fake: thousands of years of trial and error, kept alive for one reason only: it kept people alive. A method that failed would have vanished inside one lifetime. A method that survived 3,000 years, discovered independently across 4 continents by people who never met, earned that survival honestly, through results nobody could explain, and nobody could afford to walk away from. You've probably been taught to picture ancient medicine as something humanity escaped on the way to real science. A phase. A mistake corrected. It wasn't a mistake. It was a discovery we misplaced, one so effective that modern medicine, after quietly ignoring it for 80 years, is now going back and asking it for help. Not out of nostalgia for the past. Out of necessity, for what's coming. The next time you reach for a bandage, remember this: some of the oldest medicine in human history isn't behind glass in a museum. It's sitting in